our next session during the Black Health Matters Fall Health Summit. And you've just finished hearing information about cardiovascular disease. And we're going to take that a step further and talk about how cardiovascular disease and even diseases like diabetes or symptoms like diabetes can affect outcomes for influenza. And this is influenza season. We often don't think about the intersectionality of various diseases, and we have to consider how cardiovascular disease and diabetes can increase the risks associated with the flu. And so we have two distinguished PhDs to share a discussion about those issues. We want to join us in welcoming Dr. Bobby Banks and Dr. Donald J. Alcindor for a detailed discourse about the effects of influenza on those with diabetes and cardiovascular disease. Dr. Bobby Banks, PhD, is a scholar activist committed to equity and inclusion. Her work has led to a career that has expanded the Americas, Africa, Europe, and Australia, including contributions to the World Health Organization and academic institutions across the United States. In 2020, she launched Not a Host, a multimedia grassroots campaign designed to advance health literacy in the midst of the COVID-19 pandemic, which has been supported by the Maya Angelou Center for Health Equity at Wake Forest University and Ride United NC. And that's a collaborative effort between Blue Cross Blue Shield of North Carolina, the Blue Cross Blue Shield North Carolina Foundation, Duke Energy, United Way of the Greater Triangle of North Carolina, and the North Carolina Department of Health and Human Services, and the Bank of America and North Carolina Department of Transportation, North Carolina Department of Transportation. Dr. Banks currently serves as an adjunct assistant professor in the Public Health Leadership Program at University of North Carolina, Chapel Hill. And she was recently recognized with the Boston University School of Public Health Distinguished Alumni Award. She's also the principal and owner of Pillar Consulting, RTP, and you can learn more information about that organization at pillarconsultingrtp.com. Dr. Donald Alcindor, MS and PhD, is a former special government employee of the Food and Drug Administration Center for Drug Evaluation and Research. He's also a voting member of the FDA Antiviral Drug Advisory Board, currently known as the Antimicrobial Advisory Committee. Dr. Alcindor has been a research consultant to the Viral Vector Core Laboratory in Viral Oncology at Johns Hopkins University, and was a cytomegalovirus expert for the FDA Division of Vaccine Inquiry and Compensation. He's currently an associate professor at the Center for AIDS Health Disparities Research and the Division of Microbiology and Immunology, Physiology and Obstetrics and Gynecology at the renowned Meharry Medical College in Nashville, Tennessee, the first medical school for African Americans in the South. Join me now in welcoming Dr. Bobby Banks and Dr. Alcindor. Thank you so very much for joining us today. Take it away.
I want to talk to you today. Our conversation today will be how diabetes and cardiovascular disease can impact influenza risk. It's very clear that there are health disparities associated with chronic conditions in the United States. And of course, influenza can exacerbate those conditions. So when we look at ethnicity and race, we clearly see that African Americans and Hispanic Latinx communities are more likely to have issues with the flu, and in this case, less uptake of the flu vaccine. So there is less uptake among minority communities for the flu vaccine. And of course, there's less uptake, there are likely to be more morbidity and mortality associated with less uptake. When we look at hospitalizations for these populations, it's very clear that African Americans have a higher risk of hospitalization that is more than twice that of non-Hispanic whites, along with Latinx and Hispanic communities as well. When we look at influenza vaccination percentage and death per 100,000, if we look at that rate again, African Americans have less uptake of the influenza vaccine and increased death rates compared to other populations in the United States. When we look at chronic disease death rates by race and ethnicity, what we clearly see when we look at diabetes, heart disease, and cancer, again, we see Black and brown communities having higher rates of death associated with these chronic conditions, particularly African Americans. We understand that social determinants of health are the foundation of a person being able to avoid chronic disease, mortality, morbidity and mortality associated with chronic diseases. That is your economic stability, your neighborhood and physical environment, the education, health literacy that you have, your access to good food, your social connections in the community, and your access to the health infrastructure. What we clearly see, there are medical complications with the condition that many people might not see as a chronic condition, but it is, and that is obesity. When we look at pulmonary disease, cardiovascular disease, diabetes, hypertension, and cancer, obesity puts you at a greater risk of developing all of these chronic conditions that can be, over time, life-threatening. The flu can be very serious for anybody, but for those that have chronic conditions, it's more important, meaning that the flu can exacerbate chronic conditions and turn them into life-threatening morbidity, life-threatening mortality. When we look at neurological disorders, pulmonary conditions, heart disease, morbidity associated with obesity in adults, liver disease, diabetes, suppressed immune conditions, and end-stage renal disease, the flu infection can make this worse. So you should get the flu vaccine. If you're age 6 months and over, it's important that you get the flu vaccine. When we look at older adults, in particular, having heart disease, HIV, obesity, asthma, diabetes, and other chronic pulmonary diseases, what we see is that they have a higher risk of developing more serious complications of all of these chronic diseases. So when we look at this, 15 million people that have heart disease are 10 times more likely to have a heart attack in the first 3 days of contracting a flu infection. 31 million people that have asthma or COPD put themselves at a greater risk for flu complications. 31 million people that have diabetes have a 6 times more risk of flu-related hospitalizations. So what it is that the flu has a great impact on these chronic diseases that can lead to morbidity and mortality in elderly populations as well. When we look at diabetes, don't spin the wheel with diabetes. Diabetes should be managed. And of course, diabetes can lead to increased risk of stroke, heart attack, peripheral artery disease, eye disease in terms of diabetic retinopathy, cataracts, and glaucoma, can lead to peripheral neuropathy and end-stage renal disease. When we look at flu and diabetes, it's clear that your immune system would be compromised if you have diabetes. And the idea is that if your immune system is compromised, you're more likely to have life-threatening complications associated with the flu, in particular, bacterial pneumonia that can be life-threatening in that population. People with diabetes are more susceptible to infections because of the increase in blood sugar levels in that population. And again, reduced blood flow to extremities can lead to increased vulnerabilities to infection as well. So everyone with diabetes should have their diabetes managed. And even if you're pregnant, you should get the flu vaccine. getting the flu vaccine is more important than ever. And of course, getting the flu vaccine would put you at less risk if you were to come down with a COVID-19 and its complications. There are few exceptions to people that should get the flu vaccine. For those that shouldn't get the flu vaccine, if you ever had an allergic reaction to the flu vaccine in the past, you should not receive it. For some individuals that have allergies to egg proteins, should talk to their doctor before getting the flu vaccine. And if you currently have symptoms of the flu or a common cold. When we look at flu infections, we know that they can cause changes in blood sugar levels and can prevent people with diabetes from eating properly. And of course, diabetes can make the immune system less able to fight infections. And of course, a person with diabetes is always at risk of developing a condition called ketoacidosis, a condition when the body cannot use sugar as a fuel source because no insulin is available. When we look at diabetes as an increased risk for lung disease, it's clear that a person making a clinical presentation that has hypoglycemia and they were to get a flu virus infection, one of the things that can happen in those individuals, they will develop systemic inflammation. They will experience a condition referred to as a cytokine storm. In the hospital, the ideal treatment for this inflammation surge will be corticosteroids. However, corticosteroids is contraindicated in that patient that's hypoglycemic because it can lead to an increase in blood glucose levels. And of course, this has been associated with lung injury and poor immune response to infection and delayed viral clearance. So it's important if you have diabetes or lung disease to lower your risk if you come down with flu. So to do this, there are many things that are important, and you need to stay healthy by monitoring your condition, taking your medication, exercising, and eating healthy. Influenza infection with a person that have accelerated graft atherosclerosis can lead to a number of chronic conditions of the heart that can lead to acute myocardial infarction. And again, this can occur in a person that has heart disease and they contract the flu within 3 days. So when we look at cardiovascular disease and influenza, people with heart trouble are more likely to get the flu than people that don't have this problem. Viral infections like the flu can put added stress on the body and affect blood pressure and heart rate and overall heart function. And of course, the flu can make cholesterol-filled plaques more vulnerable to rupture and form blood clots and cause heart attacks and sudden death. People with heart disease are 6 times more likely to have a heart attack after coming down with the flu. Severe flu symptoms can also put stress on the heart and increase risk of worsening conditions, heart failure, and even heart arrhythmias. So the Center for Disease Control and Prevention, while vaccine effectiveness can vary, recent studies show that flu vaccination reduced the risk of flu illness between 40 and 60% among the overall population during a flu season. So the dangers of influenza, why people with heart disease need to get vaccinated: 15 million US adults diagnosed with heart disease puts them at greater risk for flu-related complications. 10 times increased risk for heart attack within 3 days. Inflammation of the body, hospitalizations, increased risk of stroke, permanent physical disabilities, and of course, higher risk of death. So when we look at this, pneumonia, sepsis, coronary heart disease for people that have diabetes and the flu, 30% of adults hospitalized with the flu were diabetics. The flu vaccination can reduce hospitalization in diabetics by nearly 80%. And did you know that the influenza vaccination can help prevent heart attacks? So there's up to 10 times greater risk for heart attacks within a week following a flu infection. And we look at influenza vaccine at reducing your risk by up to 45%. And if you compare that to smoking cessation, cholesterol medication, and of course, high blood pressure medication, the flu vaccine increases your risk at an even greater percentage than those interventions. So a new study that was done with 80,000 adults that were hospitalized with the flu found serious and sudden heart complications were common among this group. 1 in 8 patients had sudden heart complications. Of these patients, almost 1/3 were admitted to ICU. So get the flu vaccine to reduce your risk of complications. And of course, the flu and heart disease, you can have serious complications. And again, this can include pneumonia that can be life-threatening, a heart attack, hospitalization, stroke, and death. So exercise, take your medication, eat a healthy diet, and don't smoke. And of course, get the flu vaccine. And so when we look at heart disease and flu, it's very important to take care of yourself because flu and heart disease does not mix. And of course, get your influenza vaccine to fight not only the flu, but also your risk of having chronic morbidity associated with heart disease and even death. And so when we look at the numbers, 38 million flu illnesses in the last flu season, 400,000 flu hospitalizations, 22,000 flu deaths associated with the flu. And of course, if we could intervene with the flu vaccine, it is very clear that the flu vaccine would have made a clear difference, could have reduced this to 7.5 million flu illnesses, 105,000 hospitalizations, and only 6,300 deaths. So again, the impact of the flu vaccine here is very real. When we think about vaccines in general, in 1960, we had only 5 vaccines available to us: polio, smallpox, diphtheria, pertussis, and tetanus. Now, since 2019, if you're an 18-month-old baby until 18 years old, you will get 74 vaccinations. 18 of them will be the flu vaccine. So by the time you're 18 years old, you've had a tremendous amount of experience getting the flu vaccine. And again, for all parents that have school children, that is, you have to vaccinate your children to go to public school because it's mandated by the state. And of course, when you ask yourself, how many of my children have had adverse reactions to the flu vaccine over these 18 vaccinations? I hear no mothers saying anything because vaccinations in general have been safe and effective for decades. That includes the flu vaccine. Vaccines are the most critically scrutinized public health interventions that we know. Vaccines in general have allowed us to live 30 years longer than we did 100 years ago. And of course, vaccines are scrutinized by 3-phase clinical trials, a data safety monitoring board, the FDA advisory board, and then the FDA. And again, guidance is given by an independent body in the form of the CDC advisory board before they're given to the public. So what's in a vaccine? A vaccine is mainly water with preservatives. There is some residual trace elements. Sometimes a vaccine is given with an adjuvant to potentiate the immune response. And then there's a small portion of a harmless form of the bacteria or virus that you're immunized against. So there's no secret to what's in a vaccine. And again, the flu vaccine can come to you these days in many different flavors. You can have the high dose for people that are 65 and older, the standard vaccine for infants, 6 months, and healthy adults, and even pregnant women. And again, if you're allergic to eggs, you can have the egg-free vaccine. If you're concerned about needles, you can have a needle-free vaccine for ages 18 to 64. And of course, an easy squeezy would be the nasal spray vaccine. So over the years, we have done a lot with vaccines to protect the public. And the idea is that preventable diseases have been put in jail, so to speak, because of vaccines. We don't want to let them out, so to speak. And the idea is that anti-vaxxers and those people out there that carrying misinformation about the flu vaccine and other vaccines that lead to conspiracy theories, we would prefer that not to happen. So we're in the business at Meharry Medical College of debunking these myths. The cold or the flu, they can be similar in ways, but we all know they're very different. And if you throw COVID-19 on top of this, this can be confusing. So make sure that you're not confusing the flu with the common cold or COVID-19. And of course, here are all the complications and symptoms. All of these, particularly the common cold, can lead to secondary pneumonia. Flu can certainly lead, and a coronavirus, again, we're talking about a virus that it can be quite lethal, particularly in elderly populations and people with underlying comorbidities. I'd like to thank you for having me today. If you'd like to reach me, you can reach me by my email, dalcendor@mmc.edu. Thank you for having me.
Thank you so much for this presentation. And I apologize for not jumping in sooner as the moderator and letting people know that you can drop your questions in the chat window or the Q&A. And it has been going off, which is great to know. But thank you so much, Dr. Alcindor, for sharing this information. For those of you who are not on kind of the pre-screen presentation before we came here, Dr. Alcindor said, you know, I tend to be very thorough with my work. And I said, that's what we need you to do, sir. We need you to be thorough with the science so that we fully understand what's going on, not only with the flu, but your work with vaccines in general. So thank you for sharing that information. And my job is to help make it plain to folks. I'm always in the translational space, in the vein of health equity, just to kind of make things simple. Red light, green light, light switch on, light switch off. So I'm going to read a couple of questions from the chat. The first one, I just want to make sure, because someone asked, what is a myocardial infarction? That's a heart attack, correct?
That is correct. Myocardial infarction.
Infarction
Yes.
is a heart attack. So when you were speaking about that, you're talking about increased risk of a heart attack for
That's
those
correct.
who have diabetes
That
or
is correct.
cardiovascular or heart disease. Okay. Someone else wants to know about you talked about the social determinants of health. And so we have individuals, but then we have bigger, like communities,
So we have communities,
policies and environments and all of that. Another question here, you had a diagram that showed the evolution of vaccines and how they have helped to save lives. And one of the things that you said by the time that someone is 18, they would have had 18 flu shots. Can you tell people why?
Yeah, so the idea is that the flu is a little bit different every year. And so before the flu vaccine is developed, it is developed 6 months before it's needed. And the idea is that there are laboratories around the world that get together and they look at the different vaccines that are currently circulating in the global population. And then they decide what particular strains of flu that should go into the flu vaccine. Once that's been identified, the flu vaccine is then manufactured. And again, it has to be manufactured ahead of time. And the flu vaccine is actually cultivated in embryonated chicken eggs to this day. And the reason being is that embryonated chicken eggs are very cheap, and you're able to grow a tremendous amount of flu virus in an embryonated chicken egg in the allantoic sac of this embryonated egg. And again, it's easy to extract. One of the complications of growing the influenza virus in these embryonated chicken eggs is that it's contaminated oftentimes with albumin, which is egg proteins, and can often be problematic for people that have egg allergies. And so, but again, they start ahead of time. They identify what is important to protect people in terms of the global community. And then that is decided, and then that information goes into development of the flu vaccine for that next season. And so next year, it's going to be a little different. There are likely to be different strains circulating. And of course, different formulations in the flu vaccine will be needed. And that's why you get one every year.
Okay. There's a question in the chat that I want to get to. You talked about egg allergies, and I just want to make sure, when you say different strains of the flu, people have been hearing a lot with COVID-19 that they mutate, or there are variants. Is that the same thing with the flu? Or are you saying that viruses kind of just keep trying to change to be more efficient? I'm trying to
So the idea is that this is genetic mutation that occurs within the viruses as they replicate in a person. You see what I'm saying? Mm-hmm. And so in terms of COVID-19, we have different variants. These are genetic changes, what we call point mutations within a certain genes of the virus that makes the virus different enough to where you you need protection that will allow you to be able to deal with this new change or new version of the virus. And so in the case of influenza, you can have small changes or you can have even large changes in influenza. This is where a human influenza virus now, it has a genetic change that can be with birds or pig viruses. So I know you've heard of swine influenza and you've heard of avian influenza. This is where, and again, this is getting real technical here, but this is where there's an exchange between hemagglutinin and neuraminidase antigens between animal influenza viruses and human influenza viruses. And you might ask yourself, how does this happen that animal and human influenza viruses come together? It turns out certain places in the world, animals and people are in very close proximity of one another and can transmit infections to the other person. And one note that's very important here is that the pig is very important because the pig serves as a mixing vessel because the pig can support both avian and human influenza viruses. You see what I'm saying?
Avian is again, bird or human.
That's exactly right. And so we've had swine influenza pandemics and avian influenza pandemics in humans over time.
Okay. Someone's asked, or someone has stated they have an egg allergy and their doctor gave them the choice to take the flu vaccine. And they said last year they did. They don't have any chronic illnesses. They have been fully vaccinated and they're trying to figure out, should they take the flu shot this year? And you mentioned a lot of things as part of what I heard was like weighing your risks and benefits of the vaccine.
Absolutely. And so this, if you've had the shot and you know you have egg allergies, there was no problem the first time out, you can expect there'll be no problems this time around as well. And getting that flu shot, the benefit to risk ratio based upon your previous flu vaccination, I would say is very small.
Okay. Someone has a question. Can you explain how long the flu season lasts and when should a person receive the flu vaccine, and then do they need a booster?
So the idea is that the flu vaccine, you should get it as soon as possible. And again, the flu can start as early as late spring and last into the winter season. And again, the flu is more devastating in the winter months because we tend to gather together more closely. We tend to gather in rooms that are warm, that have more humidity, and transmission can occur more readily within those tight gatherings. And the idea is that the flu, however, is seasonal because we see very little flu during the summer months. The COVID-19 virus is a different animal altogether. This virus killed people in the summer, spring, winter, and fall. And so this is a clear difference between a seasonal endemic infection like the flu and COVID-19 that kills all year long and will likely become endemic in the United States as well over time.
Mm-hmm. Someone has stated that they haven't had the flu vaccine in previous years. Is there, again, going back to kind of weighing your risk and benefits, what is the importance of getting it now?
So I've seen this cavalier attitude about the flu vaccine. I've never had the flu in all these years of my life, and I don't feel that the flu vaccine is necessary. Let me say this one thing. As you grow older, you're going to run into chronic conditions just as a matter of aging. These chronic conditions will put you at greater risk. If you're saying you don't need the flu vaccine and you're sitting there with diabetes and heart disease, you could be playing Russian roulette with hospitalizations and death by not accepting the flu vaccine. And so, as an elderly person, you can clearly see that if you were to get influenza, it can be life-threatening and again lead to hospitalizations and possible death in those individuals. So being cavalier about the flu vaccine is something that's unwarranted, I would say. And the idea is that the benefits are there for getting the flu vaccine, particularly in the very young and the very old. The flu vaccine is very important because that's where we see the 22,000 deaths that we saw last year during the flu season, in the very young, mostly, and in the very old.
Mm. And what impact has COVID had on this? Because we typically have a flu season. Now we have flu season and coronavirus or COVID-19 is here.
And so this is one thing that people probably don't think about is that the CDC guidelines for COVID-19 mitigation has really, really helped reduce the incidence of influenza in the general population, like in ways that we've never seen before. So when you think about how flu is transmitted, it is transmitted through your T-zone, through your eyes, your nose, and your mouth. And the idea here is that if you practice by covering your nose and mouth and eyes with the shield, and of course, social distancing and washing your hands, and not because the hands serve as to facilitate transmission of the flu very easily. And the idea is that by doing those CDC guideline measures, we have seen great reduction in influenza infection in the United States like we have never seen before. However, COVID-19 is a different animal altogether, but it's clear that a person with the flu and then getting COVID-19, this could certainly exacerbate the conditions, especially if the cold is bad and is likely to lead to a pneumonia. Getting COVID-19 can add more complications to lung disease that can be life-threatening.
Wow. I'm trying to watch time here before they kick us both off. There's a question, can people get the flu and COVID vaccines at the same time?
I was asked this question the other night at a church, and the idea is that you certainly can. There's no problems with getting both vaccines together. If you're concerned, you can get them in different arms. For children that are getting the flu vaccine and the COVID-19 vaccine, and I want to say, it has been approved, the Pfizer vaccine for 5 to 11 years old. And again, very important, they can now be vaccinated for COVID-19 along with other adults. And of course, getting that flu vaccine is so important. And again, pediatric patients can get as many as 6 vaccinations at the same clinical visits. So the idea of getting both of those together is something you can do and you should do. And at one time, they were telling you to get the flu vaccine 7 to 14 days before you get the COVID-19 vaccine. That has been recently taken off the table.
I'm on mute, I'm sorry.
I'm sorry.
I think we have time for one final question. And if we have time for more, someone just message me in the chat, let me know. But okay, when you stop taking the flu shot, are you then weakening your immune system and your body's ability to fight out the virus? And so for those who don't understand what immune system is, can you explain that as well? Because I think we assume that people know. So
your immune system is the way your body has developed over evolutionary times, a way of fighting infection. So if you didn't have an immune system protect you against infection, first of all, your immune system protects you from cancer as well. There are cells in your body that go astray. These are called transformed cells. These transformed cells are precancerous cells. Your body's immune system, and there's an immune cell called the cytotoxic T cell. It is designed to shut those cells down that go astray and can be developed into cancer. The immune system protects you every day from everything that you encounter. You take a 5-year-old child or a baby, they're getting infections all the time that you don't even know about. Because their immune system is healthy, you won't know about them because the immune system will keep them in check. Without your immune system, you would pass away quite readily. And for those people that have immune dysfunctions or immune suppressive disorders, like the HIV patient, the immune suppression of an HIV infected person that is untreated will ultimately lead to their death. The reason being is that they have infections that will then become life-threatening when their immune system falls below a level of protecting them. And so your immune system does 2 things that are very important in terms of virus infections. When you're infected with a virus, the immune system is now challenged. And as a result of that challenge, the immune system does 2 things. It makes antibodies to that infectious agent, and it makes memory cells to that infectious agent. So the antibodies are used to bind to the infectious agent and prevent it from entering the cell to cause an infection process. The memory cells are designed to remember that infection for a later time of exposure. So once you get injected with a vaccine, your body produces antibodies and memory cells. And when you get a natural infection, your body remembers that infection and mounts an assault on that infection very quickly. Over time, a person's antibody levels can fall. And with the falling antibody levels means that your level of protection has decreased. A booster now comes into play to actually stimulate that antibody levels again and get it to the high levels it needs to be to protect you even more if you come into contact with a natural infection. Is that helpful?
That's very helpful. They are kicking us out.
Okay.
In all seriousness, I know that people have so many questions. I thank you for those who have submitted questions and want to also encourage you to go to flushotfriday.com and you can learn more information as you weigh the risk and benefits of the flu shot. And Dr. Alcindor has presented a lot of great information for people to consider, particularly if they have cardiovascular disease or diabetes that leave your body more susceptible to disease. We want to thank Sanofi Pasteur and the American Nurses Association. My eyes have been doing this the whole time. And want everyone to continue sharing this information, continue to ask your questions. You can look at the hashtag #FluShotFridays to find out more about the flu vaccine and how this can help to prevent high risk disease or mortality or death or morbidities, as you mentioned, lots of other diseases that you have to grapple with as part of your everyday life. Thank you so much for attending Black Health Matters. Thank you for the opportunity to serve. And thank you, Dr. Alcindor, for sharing this information. I apologize for the dog in the background.
No problem. Thank you for having me.